Welcome, everyone, and thank you for joining us. This session, entitled Living with Cancer, Navigating Life Beyond the Diagnosis, brings together a group of inspiring panelists who will share their lived experiences and insights. I should comment, too, that we welcome people all the way from Vancouver to Newfoundland this morning as well. We'll explore the evolving role of the patient voice, the financial and work-related challenges of living with cancer, how to navigate the healthcare system, and the emotional and psychosocial impact of cancer on individuals and families. This is a space for open conversation, and one of the things that I've gotten out of the conversation in reviewing and discussing with the panelists this morning is that it's a reminder that you don't have to be okay all the time. So let's begin. I'm going to do some brief introductions before we get into the conversation. Regan Garrett is a clinical exercise physiologist and the exercise program lead at Inspire Health Supportive Cancer Care in Vancouver. Welcome, Regan. Laurence Gauthier-Desroches is a social worker based in Montreal with a deep passion for accessible mental health support and fostering genuine community connections. Laurence is also a patient support specialist at Colorectal Cancer Canada and is committed to providing compassionate assistance and advocacy for patients and their families. Eileen Schiller is a social worker and senior program manager at Wellspring Support Foundation. For those of you who don't know, Wellspring is a Canada-wide network of community-based charities offering programs and services at no charge and without referral to anyone with any type of cancer at any stage in their journey. I know that Eileen is going to be talking more about the wonderful work that Wellspring does. Natalie Leon is a highly skilled nurse clinician who has been a valued member of the Jewish General Hospital for nearly 2 decades. And in her current role as a nurse navigator, which we're going to learn about today, within the colorectal cancer division, Natalie works closely with a multidisciplinary medical team to ensure patients fully comprehend their personal care plans. And last but not least, we welcome Tracy Slaney from Newfoundland, who is a caregiver and will talk about the important role and the need for the inclusion of the caregiver perspective in cancer care. Welcome, everyone. Thank you so much for being here. I'm going to start this session with a question, which is really around the terminology of patient-centered care, term that we oftentimes hear. And certainly we know that we want to try and understand what that means today, but how it's evolved and changed the definition of cancer care over the past couple of decades, and where this concept of patient-centered care is evolving to over the next few years. So Eileen, may I ask you please to begin with getting us off on the right foot on this conversation?
Absolutely, absolutely. So I think that patient-centered care is all about moving away from the pure medical model of cancer care. It's a much more holistic perspective. It's not just looking at the person in front of you as the patient. It's recognizing each patient's needs and preferences and values and looking beyond the disease. So focusing also on the physical, the emotional, the psychological, the social, the family perspectives, spiritual, financial. So again, this very holistic picture of a person going through cancer.
Mm-hmm. Regan, in your work, would you agree with that? Is there aspects of what is a broad definition that you think have significantly evolved over the past little while?
Yeah, absolutely. And I can speak to my experience working with Inspire Health, and just for a little bit more information on that, we're a clinician-led supportive care organization providing free and accessible both one-on-one and group support throughout Canada. And I think springboarding off of what Eileen mentioned, it's also that ability of that individual experiencing cancer to be able to lead the conversations, to identify the things that are the most important to them, maybe different goals that they do have. And what we've seen over the last 30 years of providing a model such as that at Inspire Health is that it really does help empower the patient, I think so much of the cancer care journey can be a bit of that control stripped, right? Because you know, or you get the diagnosis, you are told that this is the treatment that you need and whatnot. So that ability to be able to identify the pieces that are important to them and also being able to holistically view that individual and work hopefully with a team of interdisciplinary clinicians who are working together can be really impactful for that person going through that diagnosis.
You said something super important here, which is the person with cancer leads the conversation.
Mm-hmm.
Build on that. Natalie, what do you think?
I think that's an excellent point. In our institution, we highly promote fostering a trusting relationship between the clinician, the medical professionals around the table, and the patient. So we really highlight the shared cared model of decision making. As Eileen had said, bringing to the table the preferences, the values, because we like to focus on the quality of life, not just the treatment itself, but how does that impact your overall quality of life, not only for yourself, but for your family as well. So we look at the individual wellness that we want to continue to promote throughout the cancer journey.
Mm-hmm. Laurence, what's your thoughts on this?
Yeah, I would say that this is absolutely coherent with the approach that we want to have here at CCC. So really considering the patient as an expert on their own situation and on their own needs. So our team is really making efforts to meet the community where they are at and allow patients and caregivers to make informed decisions that are right for them and that may differentiate from families from patient to patient. So really in considering the totality of their life experience, their value system, cultural consideration, preference, and their unique reality.
Yeah. You know, Tracy, as a caregiver, this point about leading the conversation, or the patient leads the conversation, so much of it does need to engage caregivers. What's been your experience?
I guess my experience is that when it comes to patient-centered care, a lot of times we're still so wrapped up in the medical aspect of it that we don't see the patient or the family as a whole. And I think it's important for us to keep in mind and keep striving towards looking at the patient's life as a whole, what it involves, who's involved in that. And I think I see a little more of it coming now, but I'm also 5 years in, and I've advocated for myself and my family all along. So I think the changes I'm seeing are because I kind of forced them as opposed to waited for them, but I'd like to see them everywhere.
Yeah. I think it's a very interesting point you raise, and maybe I can ask folks who are, working with patients and families every day, is conceptually it makes perfect sense that the holistic care model is applied, that the patient provides their voice, but what are the physical things or the things that a family can do to bridge that gap between maybe what is happening today and the vision that we have for patient-centered care? What are those specific things that organizations like Inspire Health are doing, or Wellspring as an example? Regan, do you want to take that?
Yeah, I had to find my mute button or my unmute button. So with Inspire Health, and just making sure that I'm understanding the question correctly, you're curious about the different ways that our organization is helping to reinstate or make sure that this person-centered model is at the front of the care.
Yeah, very well said.
So, I mean, in a couple ways, I think that it's really important to have as the least amount of barriers as possible, right? So having folks be aware that our services do exist, having free support so that we're able to be accessed even if there isn't extended medical or there's a cost out of pocket, making sure that we have a virtual model in place. So even if you are located in a rural community, you still have that same access as someone who's located in the more populated metro areas. Or, for example, if you're low on energy and you are maybe have enough capacity to join a group class or a one-on-one clinician appointment, but don't have enough to commute, have that appointment, and then come on back. Or maybe you're immunocompromised. And I think that a way that it's also addressed is making sure that we have those different clinician areas to help identify those different quality of life pieces that could be addressed with that person to make sure that their quality of life is as high as possible. So, for example, if it's an exercise support, can we be starting to implement those different pieces so that we're helping to manage fatigue? And of course, overall, that would have further benefits. If it's stress management or mitigation, making sure that people have programs that suit their preferences, but also identifying the things that are factors in their stress. So again, coming into that financial piece and whatnot.
Thank you for that. Eileen, would you like to build? Because
Yeah. So from Wellspring's perspective, it's getting the word out. It's letting patients in the hospitals know that there are organizations like Wellspring that exist, and having that be sort of a bridge to coming into Wellspring. And once they're there, we use a peer support model so that people are introduced to our programs through somebody who has been through the cancer experience. So they can have that frank conversation with somebody who might have had the same type of cancer or similar treatment protocol, and they'll take them through the different programs that might be available. So that serves to sort of welcome them in and get them over the hump of getting into the programs. And also, I find that when people's concerns and things that they are experiencing are normalized or validated, it just makes them eager to sort of want to reach out and get the support that they need. My favorite thing of being in a support group is, yes, the educational components that we give, but it's that mutual support. When you see somebody talk about a concern that they're having and there are all these, heads nodding up and down that, hey, somebody else, is experiencing the exact same thing as me, they get it. And that to me is phenomenal.
I agree. The education you can get from some of these support groups is astounding. I want to bridge now into a conversation around navigating the healthcare system. And Natalie, it would be helpful, I think, to the folks that are listening to talk about this idea of what a nurse navigator is, particularly as it relates to cancer. There's more and more of this navigation language that's coming out. So maybe you can give us or paint a picture of the specifics, what you do, how people can access it, and continue to benefit from the services.
Thank you for the opportunity, because unfortunately, as you pointed out, a lot of times patients don't know that nurse navigators do exist, and we are here to help. A nurse navigator is a specialized healthcare professional that helps with the complexities that patients face throughout their cancer journey. In Quebec, we have a model with a pillar of 5 different components that we touch upon. Patient education, which is very important. And the patient education piece is more, from my end, how I like to fancy it, is discussing the medical knowledge that you're hearing with all that medical jargon in more of a relatable term, so the patient and family members can understand what are the treatment options, the procedures that are coming and that we're proposing. Care coordination. Coordination is paramount. It's very easy to get lost in this medical system. And scheduling appointments, managing the communication, not only within your institution, but outside the institution with community resources is also key. The emotional support that we can offer to family members and the patients that are going through this chronic illness, and resource management. So hearing about Wellsprings and different community resources that are out there, it's wonderful because this sheds light that patients often don't hear because we're just focused on the managing of symptoms, managing of the illness, and getting over all of these difficulties and challenges that we're facing. that sometimes knowing that there's external resources that are out there, it doesn't get shone upon enough. And lastly, advocacy. Sometimes when we sit in front of a professional, we're afraid to challenge the narrative of what's being told to us. So as a nurse navigator, I put myself with the patient to be present during those difficult conversations with the medical team so that their concerns can be brought to the forefront and heard so that we can address them. Because as Reagan mentioned earlier, identifying what are struggles for patients is key. And sometimes we feel that we have to hold on to it and we don't know how to share that challenges that we're facing so that we as a medical team can help work with those challenges to make it not as arduous for the patient.
I want to bring Tracy into this conversation, but before I do, question number one is, if I've just been diagnosed, where do I get a nurse navigator? Does everybody have access to one?
You know what? The internet has become a wonderful thing. So at our hospital, and I believe in most hospitals across Canada, if you go into the directory, you can find clinical nurse navigators under different templates as a resource that is there with the contact number, not only for colorectal cancer, which I work in, but all the different tumor sites, breast, pulmonary. There's a nurse navigator that's there. And another option is ask your medical team. It's as simple as that, and they're happy to write the consults and connect you with the nurse navigator to help, clarify some concerns. I call myself the bridge of communication that's available for everybody that's going through their journey.
Tracy, I wanted to bring you into this conversation. Were you aware of the ability to find a nurse navigator, that they existed? What was your experience?
We were assigned a nurse navigator, but unfortunately, here in Newfoundland, they're very far and few between. So our opportunity to actually forge a bond with that nurse navigator wasn't available. And quite frankly, her caseload was just huge. So I just found it easier sometimes just to try to navigate for ourselves because it was just so hard to access a navigator, at the time that you needed them most.
So in organizations like Wellspring or Inspire, do these kind of, I'll call educational services exist in cases, for example, like Tracy, where access to a navigator perhaps is not easy or available?
At Wellspring, we don't have nurse navigators per se, but we would try and link people to the appropriate resources. We do have some general educational tools and videos and things that people can watch, but in terms of the actual sort of patient advocacy piece, we would try and find them somebody within the hospital.
Chime in there as well. So what we found is that unfortunately that there is some differences between the provinces, right? And as Tracy mentioned, sometimes it's hard to get a hold of them or you're overwhelmed with so much information. So what we do try to do is again, connect folks or help navigate those systems to help make sure that they are connected with someone depending on where they're currently living and receiving their care. But we also do have other resources in place. So we do have supportive care physicians who work as part of our organization. And their role isn't to replace your oncologist or radiologist or family physician, but more so to act as an ally alongside your cancer journey. So they can help with navigating the systems, help have discussions about different side effect mitigation techniques through evidence-based lifestyle factors, helping to understand scans and reports, percentages that are being given, all of those different pieces, and of course, referring out and also providing that community support. So as mentioned earlier, having that camaraderie with folks who might have walked a similar journey and have discussions about what really worked well for them.
Yeah. I wanted to bring you into this because it's daunting. Even the terminology and the various different things you have to do. Sometimes you just need what I call central control. And patient groups like Colorectal Cancer Canada oftentimes are the starting place outside of a medical team that perhaps don't, with best intentions, always fully understand what's available. So talk to us a little bit about the role of patient groups in, getting people into a system, getting people into navigation.
Yeah, so on our end with Colorectal Cancer Canada, we do try to meet people where they are at in their journey, and sometimes they will just have received a diagnosis. Sometimes they have been in this process for a little while and only seeking our support at that step. So we provide different type of toolkits that they can review individually and autonomously. So for instance, with self-advocacy, with understanding the illness a bit more deeper, when we were talking about navigating the system and the symptoms, side effects, and treatments, we also have our colleague Iris Carey, who works with us, who is our patient education and awareness specialist. So we do collaborate with her quite a bit in that regard. So really trying to bring as much awareness as possible, make the information accessible, and really foster that sense of community for people to have access to different places to seek the information and explore it for themselves.
So great starting place, Wellspring. A great starting place, Colorectal Cancer Canada. A great starting place if you're in the Vancouver area, Inspire Health. So lots of resources for people. I want to bridge into a conversation. Let me call it the general emotional side of cancer. There's lots of physical things, of course, that need to be dealt with by medical teams, but we oftentimes, and there's burgeoning evolution in psychosocial programs, emotional programs. Eileen, maybe you can outline and focus a little bit on what's available for people through Wellspring in that regard, just to get us started here.
Absolutely. So all different types of programs that, support the emotional and psychological side of a diagnosis. So as I mentioned, the first one being our peer support programming, and that's the opportunity to sit one-on-one with a peer who's been through the cancer journey and can offer you support. We also have many different support groups. So again, that gives you the opportunity to talk about your experience in a group environment, share resources, share feelings, that type of thing. A great tool to have. And then other programs that are geared towards helping you with strategies to cope. So coping skill programs, we have a multi-level healing journey program, for example, different types of meditation and stress management programs. So I sort of, view it when you look on our program page as a menu to sort of look at what you think might help. Once a week you can attend, for example, there's a great relaxation and visualization program, which is available in person or online. And that's an opportunity to learn some relaxation techniques, but also to chat a little bit and get that mutual support component.
Mm-hmm, mm-hmm. Have you seen growth in one type of programming versus another? Is there higher demand in a certain area?
I think year to year, we continue to have demand in all of our programs. Certainly at the onset of the pandemic and moving everything virtually, we've seen huge growth in our online center, that's for sure. But, people are now back in our centers, which is great. So really a whole range of programming, and some people, if they don't want to focus on the emotional, they'll take a nutrition program, they'll do the exercise program. It's really finding what makes them feel better.
Yeah. Natalie, how is the medical system connecting in and thinking about some of these programs for people, especially in a world where holistic care is really the focus of where we're headed here?
Speaking from my own personal experience, I could see over the years the medical system is actually picking up on this need. And we're doing a lot of referrals and encouraging patients to go to these programs. At the Jewish General Hospital, we have Hope and Cope, our wellness center, and similar to what Eileen described. There's cooking, there's relaxation, there's dance, there's peer support. And these are things that we find helps with the communication, helps normalize the experience that patients have been going through. And physicians, I can say, are now recognizing the importance of this. And they're actually writing the consults and encouraging the patients to go to these areas to get that peer support, to get that encouragement, to get the motivation to become active. And we're embracing our collaborative work that we're doing together.
I love that collaborative work. Tracy, this is a really, I think, important conversation for you again. As a caregiver, a lot of the language that's been used here is for the patients. What's been your experience with caregiver programs outside of what was available for people with cancer?
Actually, within our province, we don't have a lot of holistic options available to us. So I guess right after this, I'm going to be contacting Wellspring. But anyway, we didn't have those options available to us, nor did we have the benefit of a specific colorectal or a cancer peer support group because we live in rural Newfoundland. So our experience, unfortunately, both from the patient and caregiver side, has been almost non-existent on that approach. So,
yeah, Eileen, any comments about that in a world of virtual, in a world where caregiver focus is increasing?
Yeah, I think, if the demand is there, that the organizations have to step up to meet that demand. And I think, I hope you're able to connect with some of the virtual programs that, have been mentioned through Wellspring and through Ontario Caregiver Association, that type of thing. At least having that virtual piece would be helpful.
Yeah, perfect. Laurence, I just wanted to probe in a little bit on this issue of fear and uncertainty, which oftentimes is expressed as the most dominant feeling that people who have just been diagnosed, or frankly their families, have. Is there specific programs or things that you advise on to begin to cope with those things specifically? Fear, uncertainty of what's going to happen?
Yeah, absolutely. I would say that the unknown and uncertainty are some of the more challenging things that families, patients are going to encounter. When you just receive a diagnosis, you don't really have a specific idea of what to expect, of how to prepare. So I think that connecting each service users with a community that has some lived experience can be quite beneficial through the peer support program, through the support groups as well. Sharing as much information as we can, providing them with tools such as, guidelines on what to ask to your medical team to get a better understanding of your situation, of your options. So really want to empower people to make their own choices, but to have the capacity to make informed decisions. So I think that starts with education, with feeling supported, and making that support as accessible as possible. So with us, for instance, we offer that support remotely, which makes it possible to access it from coast to coast to coast. So really try to just meet them where they are at, and also with that, not waiting for patients and caregivers to only come to us, but also going to them. So that can translate into us attending specific events, having kiosks in hospitals, connecting through social medias, being present on those platforms on our website. So really getting the information out there and making sure that we can take the time to assess each person's needs, each person's priorities, and provide curated resources and material that answers those concerns.
Thank you. I'm going to change gears a little bit and get into what I think is a difficult and complex topic, and it's the idea of the financial side of having cancer, managing work, because in many ways your livelihood is compromised. So for those struggling financially, let's start there. what kind of programs do exist in general that people could access? And Tracy, I'll ask you in a second whether or not you were able to participate in any of these, but is there financial programs, provincially, federally? Eileen, maybe we'll start with you.
Sure. And this is just a huge area right now. There's a term now used in oncology, financial toxicity, really recognizing the distress that the financial impact of cancer can cause. And it's tough. It's managing those out-of-pocket costs. We've all parked at a hospital and know what that looks like. The gas going to and from, medication not covered by a drug plan. But then the other part of it is the lost income, the patient having to stop work, the caregiver possibly having to stop work. So yes, there are programs out there. We have federal government programs, our employment insurance sickness benefits program, Canada Pension Plan has a disability program, and then each of the provinces has their own sort of social assistance programs focusing on disability as well. The trick is finding them and then putting them all together. It's not easy to navigate. And so to the extent people are having issues in this area, first of all, knowing that they're not alone. And then speaking to a hospital social worker as a starting point. If they're in Ontario or Alberta, they're welcome to, contact our Money Matters program to help them with that very important navigation piece.
Yeah. My sense is that Wellspring has one of the most comprehensive, let me call them programs, to help with the financial side of cancer. Would that be a fair statement?
Yeah, because we have a program that's dedicated, the Money Matters program, that's dedicated to helping people with the financial side of a diagnosis. And as well, if people are taking time off of work for cancer treatment, we also have a support and education group that focuses on returning to work after being off for treatment. Very specialized.
Regan, I'd like you to weigh in on this as well.
Yeah, absolutely. So I think it's hugely important, and again, this is kind of dovetailing the beginning of our conversation too about that person-centered care. So giving folks the opportunity to, or us as clinicians, getting to know those individuals we're caring for, and having those needs and challenges be identified in those conversations, so that we're able to then connect them with the resources that do exist out in the community. I know there was a report that was released a while ago that suggests that patients who are undergoing cancer oftentimes are grappling with up to $33,000 in cost, including those out-of-pocket expenses and lost income, right? So that's a huge burden to folks. And of course, that burden would be higher on those living in those rural areas if they've got further travel costs, or those who are already coming from lower income households. So again, at Inspire Health, with our virtual care that we're able to provide throughout the country, as well as the in-person care, really making sure that we're identifying those things, connecting them with the resources that do exist with their community, or where they can get more information or help navigate the system, to connect with folks within the hospital systems, the social workers, as mentioned, and also making sure that we are having that supportive care piece there to help with the conversations about the return to work, to help with the physical aspects of that, exploring the different options there, right? So making sure that we're kind of holding that space and making sure that they're connected where they can't be.
Yeah. Tracy, did you have experience with any of what we're chatting about, the issues of financial toxicity, work challenges in your family? How did that look for you? How did you experience that? What are some of the steps you took?
I think in the beginning, we could take advantage of a lot of government programs and things, because we didn't have many other options like the caregiver benefit and stuff. But eventually, we're 5 years in, and as most people are aware, the cost of living is increasing and increasing. And so is the cost of cancer care in regards to gas and prescriptions and things like that. I really had no choice but to go back to work, whether I was ready to, whether whatever, because we had costs to pay. And that's not luxurious items. It's like I say to my kids, we had a pre-cancer budget and we have a post-cancer budget. The one that we used to have no longer exists. We now have a new financial reality. It's not as pretty as the one we had before, but we try to do it. But I will throw it out there to anyone that's listening today as a caregiver that you're not alone. I myself and my family has accrued over $75,000 in debt due to cancer care over the last 5 years because it's $33,000 per diagnosis based on a 2-year treatment plan. Unfortunately, our treatment plan has spanned 5 years. So we're much further in debt than most, but it's okay not to be okay. It's okay to reach out. And sometimes it's okay to say, we can't make it anymore on our own. That's okay. Don't be afraid to ask for help.
So thank you for sharing all of that. Tracy, you said many important things, but for people who are listening to this, even simply getting started and knowing where to begin to have the financial conversation, can you give them step 1 and then step 2? Because there's a lot there. Like, where did you start? Who did you call first?
It is. And I think for me, we would have benefited greatly from sitting down as a family and discussing finances, but we were so caught up in the diagnosis and the implications and the fear that we didn't have those financial conversations in the beginning. But I think I advise anybody who is newly diagnosed that although it's not a conversation you want to have, it's one that you need to have because you will avoid so much angst and anxiety and things about your financial future if you just sit down in the very beginning. It may not be possible in that first day, that first week, that first month, but after that, you really need to sit down and take stock of where you are. I wish that's what someone had told me, was to sit down and make a financial plan.
I'd love to hear from other panelists on this subject. Have you seen circumstances where it's worked really well and it worked really well because, or what are your thoughts in general? Not open to anyone.
If I could start, Tracy, thank you for sharing that information. I was in a meeting yesterday, a round table, and there was myself and a social worker who I've worked many cases with, and we shed light on this exact topic. When we know what's available, the path can be not as difficult. And we were trying to, brainstorm around the table whether or not introducing social services in the initial meeting with the oncologist would be beneficial. Because as you said, you're caught up in the diagnosis, the fear of what is the future going to look like. Us as health professionals know what could be coming down the pipeline. So we were thinking, how do we navigate a system best for the patient, maybe just introducing our services at the onset. You have a name, you have a card, maybe you walk out of there and you didn't ask the questions you wanted, but at least you know where to turn to in the future after you've had that discussion with your family, after the information is sunk in. So really thank you for shedding light on what we think is actually a very big need.
Other thoughts? Regan?
I want to echo what Natalie was saying. Thank you so much, Tracy, for sharing that. And I think that it's hugely important, and also to recognize the stressors that do fall on the other individuals, not just the person with the cancer diagnosis, right? So that whole support community, whether it be a parent, a sister, a spouse, right? Just the whole piece. And again, that hope to be able to support everyone involved in that care and that diagnosis.
Thank you. We're coming to the end of this session, and I wanted to ask a question. This session is entitled "Living with Cancer: Navigating Life Beyond the Diagnosis." But the reality of it is, after the diagnosis, there's treatment, the medical side of it, the emotional side of it, financial side of it. There's the living with it side of it. It's a trajectory here, and it feels like is absolutely overwhelming and daunting. So what I'd like to do is just go around the group, thinking about somebody who's just been diagnosed. What's the first thing they should do? The second thing they should do? The third thing should do? Just lay out a little bit of a roadmap or a plan for folks so that this overwhelming nature of what's in front of them can be broken down into chunks that help people to feel comfortable with managing where they need to go. I realize that's a big question, but it's kind of step 1, step 2, step 3, from the perspective of a person and a family who's just received a cancer diagnosis. Tracy, may I ask you to start with that, and then we'll go around the table.
Yep. I think the first thing I would say is take advantage of the social worker, of the navigator, of whatever's offered at your initial meeting. Take advantage of all those things. You may not be able to do anything with that knowledge at that time, but take it with you. You will need it further down the line. I think the next thing I would say would be important is to be honest. Be honest with yourself, be honest with your family, because hiding things is not the way to go. It's just really not the way to go. And you need the support. Sorry, everyone. I'm struggling with cold too. You need every bit of support that you can get. So, like, you be honest, be upfront, but don't overshare. Don't share what you're not comfortable with. But I think the main steps is to take advantage of whatever resources offered to you. Leave with those business cards, leave with those emails, leave with those numbers, because after the initial shock has wore off, you'll want all those numbers, and you're probably going to ask those people for more numbers. So just don't box yourself into the physical. Try to see it from a huge standpoint, because this is going to impact your kids, your finances, your work, your relationship, and even your relationship with your outside family, your siblings. So that's my advice.
Such beautiful advice. Thank you so much. Eileen, let's go to you next.
You know, the big thing is don't be afraid to ask for help. I know sometimes people are a little bit reluctant, but I think that once you open the door to asking for help, you'll see how normal your concerns are. If it's something you're worrying about, somebody else is worrying about, and hopefully there's a resource that can help you. And the other thing is, you know, when you get the diagnosis and the treatment plan, things are swirling around in your head, and you have this big ball of worry. Take that time to sort of pick it apart and see what type of information, what type of resources would allay your particular concerns that you're having, and you know, and try and reach out for those types of resources.
Thank you, Eileen, and to the team at Wellspring and the tremendous work they do. It's a great starting place too. Natalie.
For me, journaling. Writing down everything. It sounds laborious, but you'll find it over time. It's actually helpful. It's helpful on a psychological point where you can put everything down on paper, and it's a bit of a release. You can also find it as being proactive as you're writing all of your information, your symptoms, what you're feeling. You can bring that back to your medical team, because fear sometimes paralyzes, and we don't have the courage to come out and say what we'd like to say and what we're really going through. And we heard it already today. Acknowledging that you're not okay all the time is fine. We want to hear it. We expect to hear it. And that's the only way we can open those discussions and pull in the resources that I always call into your toolbox that you'll need to move forward.
What a beautiful answer. Thank you for that. Regan?
So I would say connecting with your supportive care organizations, and even if it's at a time where you're not sure what to utilize, if you need anything, or if it's within that first bit of diagnosis where there's a lot going on and it feels hard to know where to go, so that we are there if the time does come. And of course, here at Inspire Health, we make it as easy as possible for folks to register, and I'm sure other organizations that's the case too. But making sure that that support is connected with. And so it's really there when the time comes. And also, I think it's a call for us as clinicians and members of those different organizations to make sure that we have the word out there, right? So folks are receiving that information when they're going to their oncologists to make it as easy for folks as possible.
Yeah, I very much like the point. I'm not sure that everybody is as educated in the system as they need to be on the tremendous services that are available to folks. Laurence, I'd like to give you the last word on this. I know that as a patient group, Colorectal Cancer Canada addresses and deals with this daily. And so if you could offer what I call that first action, second action, third action steps to somebody, what would you say?
Of course, it is no small task. So just from the get go, show yourself some kindness and some patience and how you're going to experience this, and know that it's not a linear process and it's okay to feel shocked and to feel distraught. But I would encourage people to educate themselves, to get comfortable in asking questions, get comfortable in setting boundaries and voicing your needs, be intentional about honoring those needs as well, and also to do an inventory of what your support system looks like. So, the resources available through the hospital, your community resources, friends, family. So, anyone who's available, just do a brief inventory of what you may have access to, even if you don't feel you needed them right now, just to have a clear picture of what your options look like. And also, don't think that because you may be able to do it on your own means that you should. So really feel free to reach out and get comfortable with the idea, even though that's a challenge in itself.
Perfect. So on behalf of Colorectal Cancer Canada, I want to thank all of you for your unbelievable contributions. We have 15 minutes for questions, and I would think that we have many coming in, and we'll take those now. With many thanks to Regan, Laurence, Eileen, Natalie, and Tracy for their wonderful comments today. All of them have agreed to stay for the next 15 minutes or so to answer the many, many questions that we know are coming in, and I'm going to get right to it. The first question that we have from the audience relates to the ability to switch oncologists. The question specifically is, I often feel like there's little room for open conversation with my oncologist. Am I allowed to switch to someone different to oversee my care? And if I did want to do that, how would I go about making that change? So maybe Laurence, may I ask you to begin the conversation there? And as others have advice for our audience, very appreciated if you would just dive in.
Of course, yes. So it should definitely be part of a patient's right to seek a second opinion, especially if they feel communication with their current oncologist is not optimal. Now, of course, we are aware that these professionals have big caseload. It may depend on, what area you're based in. But I think it's definitely worth having a conversation if you feel some level of discomfort, if you're not feeling heard, to voice your concerns and to inquire about the possibility for a second opinion. And that can be through organizations such as Wellspring, Colorectal Cancer Canada, etc. If you're seeking additional information that you can, explore and share with your current care team, those could be first steps. But of course, if you're feeling a discomfort, it's worth exploring. You deserve to feel
taken care of and understood and heard.
Yeah. I mean, maybe I could ask you to build on that because it has to be very uncomfortable, especially with the pressures in the healthcare system today. Really, how, I want to change and it must be difficult. What would you advise people to do?
Yeah, no, you're right. Oh, sorry. Go ahead.
Yeah, go ahead.
I was just going to say it's an uncomfortable conversation to be had. And so I would encourage people to prepare ahead of time. If it's to connect with, a member of our team here, so either a social worker or our patient and education and awareness specialist, just to prepare that conversation ahead of time, that make the process a bit more seamless. Sorry, Eileen, you can jump in.
Yeah, Eileen.
Yeah, no, sorry. I was going to echo exactly what you said. Just if it's a resource thing where, it's just not possible to make a change, giving timing and that type of thing, it always helps to seek help to find a way to better communicate with the oncologist so that it's exactly what you said, so that you feel heard, and your sort of needs and wishes are taken into account.
Right. So it's A-okay to do it is the bottom line.
If I could also add on to that point, I think it's, as everybody else has mentioned around the table, it's a buddy system, it's a partnership. So if you are comfortable with other members of your treating team, feel free to discuss your concerns with the social worker or a nurse navigator and ask them to be part of that discussion with the oncologist to accompany you to the appointment. And if there's a family member that is also involved, a caregiver support, bring everybody to the table to have your voice heard and your concerns heard.
There's another question that's related to this. And so before we leave it, the question is related to what if I want a second opinion? Is that in the same kind of realm of discussion that you would have with your care team? How would one go about doing that?
I'm actually happy that has come about. This was a similar situation I had earlier today, and there was a member that said they like their oncologist. However, they're just not sure, is this the only treatment option available? And again, I said, I encourage you to go back to your oncologist, have that discussion with them. At the same time, please go and do your research. Reach out to community resources, for example, Colorectal Cancer Canada, to see what else is out there and bring the information back to the table so we can help you make the best decisions for you.
Thank you so much. I'm going to bridge into, there's a number of questions related to the financial support that one can access and how to go about accessing that. I know we touched on this a little bit in the session itself, but the question specifically is what financial help can a self-employed person get? I don't seem to qualify for anything. Eileen, I know that this is one of your favorite topics.
Yes, absolutely. So for self-employed people, the first thing to check is a lot of self-employed people assume that they're not contributing to a Canada pension plan, whereas they may be, depending on how their self-employment business is structured. So first thing, check if you are contributing to CPP and may therefore be able to apply for CPP disability benefits. If not, check to see if you might qualify financially for a social assistance program in your province. So that might be a welfare or a disability program. And then thirdly, EI does have a program for self-employed people that you can contribute to. The only thing you have to be aware of is you can't make a claim for the first year that you're enrolled in the program. So 3 starting points. And otherwise, there might be local charitable organizations you can look into.
Including Wellspring, who is a national organization and very able to guide in this capacity. Another string of really interesting question is around navigation. This one, Natalie, is very specific, so I'll throw it to you first. How can I find help navigating a post-operative diagnosis of Lars syndrome? Which is very specific. So maybe I could ask you for comments on the specificity of the ask versus the general. Several questions here on how do I even find a nurse navigator? How do I even know that there's one in my area?
very interesting question, very relevant. First step is to actually identify, do we have Lars syndrome? So that's actually, if we can keep a log, a diary of our symptoms, and at your clinical follow-up with your surgeon, review, so we can actually define what you're having. Is that really what you believe you are experiencing? Your surgeon office often has the natural resources available to support the patient. If not, your ostomy nurse can as well to guide you with how to manage a Lars syndrome. And if there is a nurse navigator involved in care, that's just an additional tool in your toolbox to help you guide. As for finding a nurse navigator, I would like to believe, and in my clinical practice, I've seen over 90% of hospitals and facilities do have nurse navigators involved. It's not always readily available, and sometimes you have to do a little bit of digging. So ask your care team. They know who's available to answer those questions and add that additional layer of support. Internet searches as well, if you go to the directory of the hospital or the care facility you're associated with, should also indicate who the nurse navigator is for that site.
Thank you. And I think one of the messages, key messages out of this session in general, is that there is a variety of different access to resources to support you and caregivers in the cancer journey that you are on. And this is actually a bridge into the next question: is how do we know where to reach out to connect, for example, with the social worker? This person says, I have only just had surgery in recent weeks and no meeting yet with the surgeon for follow-up or the oncologist. So they're looking for a social worker. Maybe Lawrence, I can ask you to comment on this one.
Of course. So a lot of the time it's possible to get a referral through the hospital directly, but there are also a lot of options that exist in the community services world. So for instance, with Colorectal Cancer Canada, this is absolutely something that people can access. So there is two of us, so myself and my colleague Chelsea Butler. So we're available to provide services both for patients and for family members, other loved ones. But if people are seeking in-person support, I would say that the first step might be to connect either with the hospital worker receiving treatment or even with their family doctor, GI nurse, so the team members that are already involved in their care.
Perfect, thank you. Is there any other comments that people wanted to add to that specific question? Okay. If not, I'm going to go to another one here, and maybe Tracy, this is where I'm going to ask for your advice too. I'm going to broaden the question a little bit. The question specifically is, who should I connect with when I'm ready to tell my children about the diagnosis? Does this resource exist? But I would broaden the question actually to say, look, as a caregiver, how do you talk to your family? How do you engage them in the conversation about the diagnosis? And who did you use to help you with that?
I know for us it came during the COVID pandemic. Um, so my kids were at home actually the day we found it ourselves.
Tracy,
They were
I'm going to
on
have to
just
stop you
one
because, pardon
room
me, let's try again
away.
because your internet is very wobbly. Let's
So
try
we had
again.
no choice but to tell them right away because we didn't want them to see signs of distress.
Great. I'm going to
Okay, so I'm
ask
right
you
away
to, your
because
internet
COVID
was cutting
pandemic
in
was
and
on the
out.
go. Yeah.
Your internet
Hopefully.
was cutting in and out, so I might ask you to give another synopsis of your answer if you wouldn't mind.
Okay, that's fine. My kids found out actually the same day we did because it was the middle of the COVID pandemic. We had no choice but to tell them right away. They were in the very next room. And we were not brutally honest. We told them what we knew when we knew it. I wish we had known about Colorectal Cancer Canada at the time, but we were just kind of stunned. And the analogy that I used for my kids is because my spouse had already had surgery. Our cancer was like a dandelion. We got what we could see above the ground, but unfortunately there was roots in other places, and we just had to try to get them all. And that's what we're doing now.
Thank you. And I know that again, your internet was a little wobbly there. Everything you said was incredibly important. But Laurence, I just wanted, if you wouldn't mind, to build on that. The question really is around the support for families as the news gets communicated broadly. If you could comment on that would be great.
Yeah, glad to. So, as a parent or a caregiver for children, a teenager, we highly encourage you to seek support for yourself, just to make sure that you're prepared to have this conversation, that you're equipped to have this communication with your younger family member in the most empathic and efficient way, just to make sure that you're protecting both yourself and them. Also to encourage them to seek out resources for themselves that are catered to their age group. So that can be through Kids Help Phone, Telgen in Quebec. There are other resources that exist. And actually something we did this year with Colorectal Cancer Canada, we built some educational video modules that families can consult. So it's called Connecting Through Cancer, the Family Toolbox. So we really address different steps of that process. So having the conversation with your children about disclosing a diagnosis, supporting them through a grieving process, and that does not only refer to losing a family member, but losing a rhythm that they've been used to as a family, losing a routine, or seeing their family member going through something that's life transforming and that's challenging.
If people wanted to see those webinars now, Laurence, are they on the colorectal cancer site?
Exactly. Yes, they are on the website. They are also on our YouTube channel, and we share additional resources for both parents and children at the end of those modules. So I think those could be a good place to start, but also seeking individual personalized support.
Yeah. So I think I'm sorry, Tracy, did you want to add just one thing?
Yeah. I think it's important to note what Laurence said, is that we had to give ourselves time to grieve the life that we had, while also looking forward to the new life that we had now. And I think it's also important to note that my kids were seeing a therapist immediately after we got our diagnosis, because I wasn't sure that I wanted to be confident that I handled it in the best way for them that I could, given that we were stage 4. I felt that it was imperative that they know the facts without, ruining a childhood.
Thank you very much for adding that comment. Unfortunately, we're at time now. And so I wanted to thank Reagan, Laurence, Eileen, Natalie, and Tracy for their wonderful contributions today. We're now going to take another 10-minute break. During that break, please do visit the exhibit hall, all of the very fine sponsors that support this event, and you'll find the colorectal cancer booth there and the list of all the resources that are available to everyone. See you after the break.